Hi, my name is Dr. Azita from Leandro Dental Studio. Today, we have lots of questions regarding what is dental crown. And today we're going to go ahead and have a couple of question answer regarding dental crowns. Well, dental crowns are the full coverage of on a tooth. For example, if this is your tooth, the crown covers whole tooth in whole. That means keeps the tooth in one piece. To do the big fillings, which we don't suggest due to the dental material shrinkage and not being very strong to hold the pressure of the chewing or grinding, whatever, then we don't suggest. So the material that we use in our office is a zirconia, which is a white metal. But there are metal, the gold is the gold standard as the best. And then next to it is a porcelain fused to metal. That means it's a metal core with the porcelain on top of it. And it has a color where the metal is showing. Sometimes it's not showing that much, but sometimes it's showing. The other one is full ceramic crowns, which we could use for our patients. And they are zirconia, they are Emax crowns, like a porcelain crown. So these are the type of, and we have baby teeth crowns, which are stainless steel. That means we call them SS crowns. They are aluminum crowns. That means we cover the baby teeth with that in order to save them for later on till they get the adult teeth erupted. So the best standard of the best is the gold crown, which is unfortunately is very old fashioned. Nobody likes it, but I love it. So gold is gold. And then it's what we use is the zirconia, which we have research that done during 8 years of the study. They had 1% of the cracks. That means the durability of a crown is very important, and how it seals the whole tooth in one piece. And how early we detect the tooth problems, like if it was a cavity or it was a crack, if we detect it on time, because sometimes when the cracks are deep, they continue to go deeper and deeper, and at the end, despite having crown, the tooth needs to be removed because the cracks were not addressed on time. That's why we always ask the patient not to postpone when they are diagnosed to have a crown on their tooth. Most of the time, yes, depends on the tooth structure. If there is a lots of decay or deficient tooth structure, then yes, needs a crown. Yes, definitely. Okay, so what we do, we numb the patient, and then we take the preliminary impression in order to make a temporary crown in order, because we take the impression, we send it to the lab, and we get it in a week or two. But in our office, we have a in-house mill. That means we make the crown in the office. That means same day you get the crown. So we prep the tooth, we prepare it, we clean the tooth, and then we scan the tooth, and we make the crown in the office. And at the same time, like in about an hour or so, the crown is ready, and then we glue the crown back on the tooth. Most of the time, we are trying to save the tooth without doing the root canal, but sometimes sensitivities follows with the placement of the crown or anything in the mouth, like a filling or a crown. But that's in order to save the tooth without the root canal. Most of the time, we ask the patient to follow up with us. It should go down, the sensitivity and discomfort, in about 2 to 3 weeks. If it doesn't go away, that means the tooth needs a second procedure, which is the root canal, we're going to go over with that in another recording. Consequences, no, you save the tooth, you get the advantage of that. You save a tooth, you save your tooth before getting cracked or losing the tooth. Children, we don't do children unless if they are baby teeth. We call it SS crown, or they are aluminum crowns. They are adjustable. We adjust it, we trim it, and then we put it on top of a baby teeth when they are severely damaged. But for like a adolescent, teenager, unless if the tooth is severely damaged, yes, we do crowns. They are like white normal, unless if they are metal-based, metal or gold. Depends on your oral hygiene. It's everything can last forever if you don't eat. If we don't eat, we don't have cavity, we don't have it. But when you have cavities, when you eat and drink, that means you are exposed to anything in the mouth. So maintaining the dental crown is really, really important. It's like anything else. If you do the haircut or a great highlight and then you just don't go to your hairdresser, it's going to go away. Imagine that it's in your mouth. It's like a very dynamic environment. Everything changes in a minute, in less than a minute, in seconds. Well, actually, we guarantee our crow's lifetime. That means whatever happens to the crown, cracks, whatever, we replace it for free. But most of the places, they guarantee 5 months, 5 years, 2 years, or no guarantee at all. That's our policy. Some of them they do, some of them they don't. Some of them they cover percentage, some of them they cover a bit of it. Depends on insurance. You call us 510-969-8510, San Leandro Dental Studio. We are open. You can call us and make an appointment. That's it. So with the dental crown, you save the tooth without getting it removed or cracked. So we strongly suggest if you are diagnosed to get the crown, do it as soon as possible. Well, I hope this one helps. See you for the next recording.